thanks so much for allowing me to be with you to share this story, really, of how we got to the point of, to use that word again, storytelling in our work. I'm honored, as you'll see, we've had just some really fun success with this work, and to be able to tell the story from weaving in the research piece with the more creative piece is exciting to me. I'll tell you, this is the first time I've really sat down to getting ready for this webinar. It's the first time I've sat down to really put all the pieces together. And because we've actually just launched the film that I'll talk about. And so looking back, and we've kept good notes and documented really our process. If you want to think about it in terms of evaluation, we've kept rigorous notes that help us with process evaluation and putting those pieces together. But sitting back and looking at it, it's been really rewarding. So thanks for the opportunity to do that. I'm going to refer to this timeline several times throughout our conversation today. Don't feel like you've got to take it all in. It's really intended to help illustrate the amount of time and effort and the number of pieces and threads that have to come together to create the tapestry that you'll see when we talk about the film. And I'll just start by saying, this really all goes back to 2017 for us at Mississippi State. It was in 2017 that we received our first rural health and safety education grant that was focused on rural opioid misuse, broadly speaking. And that year, just after we got our notice of award, the American Farm Bureau Federation released a report that they had commissioned that showed that 75% of farmers reported being impacted by the opioid crisis. Now, that's not to say that all of those that responded affirmatively were in active addiction themselves, but that they recognized that the crisis was impacting them in some way, a family member, workforce issues, that the opioid crisis really had struck home, maybe a friend, maybe a fellow church member, but they were impacted in some way by the opioid crisis. And while we had initially proposed in our rural health and safety education grant to work broadly across rural communities to engage in a broad-reaching social marketing campaign, that report really struck home for us. We were forced to reckon with the reality that, as Extension, our original mission was to farmers and to farm families, and gave us an opportunity. This report gave us an opportunity to really rethink the work that we were going to do. And we had a very supportive program officer at USDA that allowed us to go back to the drawing board and not completely rewrite our proposal that had been funded, but to rethink our approaches and to reevaluate how we would work on those efforts. Now, I'll just share with you a couple of additional findings that have come forth since then that are important for underscoring and emphasizing the importance of work around ag safety, farm stress, mental health, and producers. This is another finding from an American Farm Bureau Federation survey that showed that 61% of farmers surveyed in December 21 reported having more stress and mental health challenges than a year before. They've been doing this survey for a few years now and looking at changes in rural populations and ag producers especially. So this is pretty substantial, that more than half of our farmers are saying that stress is greater than it was a year ago. Not really surprising given all that's going on in the world, but it was nice to have that in black and white for us to see, and again, underscore the importance of the work that we're doing. Another piece of data that is really striking is that of all the industries and occupations in the United States, farming has the fourth highest rate of death by suicide. So again, part of the why behind the work that we're doing and telling the story of farm stress and the importance of work in this space. So in 2018, we got our notice of award late in 2017. So in 2018, we really began the work in earnest of adapting our focus to agricultural populations. That year, we also happened to receive support from SAMHSA, the Substance Abuse and Mental Health Services Administration, for additional work in opioid misuse prevention. We were able to use a term that I really like from the public health world, the notion of braiding and layering. We're able to really braid and layer the funding mechanisms from both agencies to increase the impact of our work. And it was in 2017, you'll hear this name again, David Garraway. David's the director of the MSU TV Center. It was in 2018, in a chance meeting, David reached out to me and just said, I'd like to get together and pick your brain about ways that we might collaborate to tell the stories around health issues in Mississippi. I've got a vision for this films initiative that I want to undertake. It was actually, I believe, October 1st is when we had lunch for the very first time. David and I knew each other just kind of because we're both at the same institutions, but we weren't buddies, didn't really have a history of any work together previously. But David, and really kind of trying to sell the services that his shop offered, just reached out to me and probably others on campus in that season as he began to realize this vision of an MSU Films initiative. So that planted the seed for me in October of 2018 that how we might really want to think about using film to tell some of the stories that we're around the issues that we're working on. But it took a while for that seed to germinate and to begin to grow in my mind. And in the meantime, we were doing more and more work to understand the root causes of farm stress. And here you see what some of those are. Of course, at that time, COVID-19 wasn't even on our radar, but it has certainly been a source of stress and distress for our ag populations since 2020. But we know that things like just livestock illness, debt overload, family disagreements, machinery breakdowns, crop yields, the regulations from the government, commodity prices, high or variable interest rates, weather patterns are all things that are real sources of stress for our ag producers and lead to a lot of uncertainty from year to year to year. One of the things I don't have a slide on, but I want to be sure that I mention is the notion of the agrarian imperative that Dr. Mike Roseman has put forward several years ago. And many of you, if you're on this webinar, you probably know Dr. Roseman's work. Was a clinical psychologist who went back, left his practice and went back to family farm to operate that. And he has continued to dabble in mental health and work at the intersection of ag and mental health. And he coined this notion of the agrarian imperative that essentially illustrates just how strongly connected individuals, farmers are to the land itself. And this is especially true among farms and farmers where the farm has been, the land has been in the family for many generations. I work with a lot of people here in Mississippi who are 7th, 8th, 9th generation farmers, and the pressure that they have to work upstream of all these causes of farm stress to maintain that family farm and that legacy is just extraordinarily challenging. And so it's, again, part of the reason we need to tell the story of why farm stress, why these poor outcomes, and to raise the profile and the awareness of what we can do about it. So again, to the point of storytelling, y'all, this is just, this is hot off the press. As you can see, June 16th, 2022. So just a little over a week ago, now out of JAMA, one of the publications of the Journal of American Medical Association puts out, they say here, we ought not ignore the personal stories that lend meaning and generate empathy and understanding in the name of evidence-based policy. Putting a human face on policy choices is crucial to internalizing the implications of these high-impact decisions. the policymakers also need the rigorous analysis to gauge the effect of policies that could have enormous consequences for so many. So we have to embrace a both and approach as we continue to try to move the needle on issues affecting really all areas of health and public health. But in this case, we're talking about farm stress and the mental health and the well-being of our farmers. So this is just one. I did a search in the JAMA at the JAMA portal on storytelling, and the medical community has been talking about the importance of storytelling for a very long time. And in public health, I don't see as much of an emphasis on that as we might want to consider. Now, of course, through our local state extension services, we have great storytelling that happens in the context of AgCom, agricultural communications, and our marketing efforts. But I don't know that we do a great job of weaving together the analysis, the data with the stories of the individual farmers on the ground. And that's what we try to do in this work that we have underway here. Another piece that I wanted to just share with you, and this is from more of a public health context, and this is from a toolkit that came out just after COVID was underway. It talks about really how storytelling works. What are the mechanisms that storytelling, how does it get sort of in our heads and help move the needle in our thinking on different issues. The first thing is that storytelling can help us understand cause and effect relationships. It helps us see patterns in important information. I think one of the most important things is that stories help us develop empathy for people. They help us put a face on the data and the statistics that we see and we hear and we read. Until there's a name and a face on those stories and those statistics, and by the way, the more local the better. But until we put a name and a face on those, the numbers just might not really move us to action. And then the final thing that they mention is that stories help us pay attention. They help draw us in. And this is really the culmination of the other three, that cause and effect, relationship piece, the patterns, the developing empathy, and all of that comes together to help us pay attention to what we're hearing and to the data that we're seeing. So I've put in boxes here work that things really begin to ramp up in 2019, 2020, and 2021 around the film. Of course, that time frame seems like a blur for all of us. We were ending 2019, we came into 2020, and then we had no idea what was about to hit us with COVID. So looking back, it's sort of, I've got the notes on when we did what, but in terms of my own memory and thinking, it's kind of all, it's all a blur. But in 2019, we continue to focus on opioid misuse prevention in agricultural producers and begin to really consider developing a film to tell the story of farm stress as I let that initial meeting with David Garraway take hold, and I began to think about what he was doing. I saw some of the work that he had done and was working on in the films industry. And when I say he's directed the TV Center, he's responsible for our internal cable network that feeds to all the dorms and to our local market here. He's responsible for the live feed at graduation and convocation, for some of the marketing efforts that come out of our Office of Public Affairs. So those kinds of things. And he just saw that they've got all these resources and wanted to coalesce those, to continue doing what they're doing, but to also work on a more sophisticated storytelling initiative. So I mentioned early on that our project officer at USDA was just extraordinarily flexible and reasonable in helping, allowing us to adapt what we were doing to work with ag populations. And when we went knocking on her door again to talk about a film and how we might use that to help tell the stories and move the needle on farm stress and opioid misuse prevention, in a sense, she was on board with that as well. And so that was we were grateful for her willingness to. It's Dr. Alicia Shipley, just by the way, so you know who it is. I want to be sure I say her name because she is really remarkable, flexible, and incredible professional. Um, and so, with that permission, we began working on the film concept more in earnest and recruiting farmers. David Garraway's team, they have a formula that they like to use. They refer to it as a formula, an approach that they like to use when they're beginning to tell a story. And they really talk about the conflict and setting the tone for the conflict here, seeing that conflict escalate and then a resolution to that conflict. And so we talked about developing this story in the context of that formula, the conflict and resolution kind of tension that they like to use. So it was in 2020 we were able to identify our first farmer, and we brought them on board, completed that film. I stay on this for a minute and talk about this, but Nathan Casburn is the third farmer in the series, but he was the first film that we actually completed. Nathan is a young farmer in the Mississippi Delta who is in recovery from opioid misuse, opioid addiction. And the story of his recovery, of his path to addiction and then recovery is just remarkable. Now, just to be 100% transparent and clear about what you're watching with him, is we talk about, sometimes we talk about farm stress as the source of opioid misuse and addiction and these other adverse outcomes. In the case of Nathan, while he grew up on a farm and that was part of his upbringing, he doesn't really attribute the farm itself, the stress from the farm. He does not attribute his opioid addiction to that. In contrast, though, he talks about, really it's the other direction, that the farm has been a place of healing and a source of hope and a place of recovery for him. He emphasizes in his film the importance of seeking help, and that's a message that all of us need to hear who are struggling with mental health challenges. And it's especially important for our ag producers as well to know that there are other producers that have struggled and have sought help. And so the message that he conveys about the importance of seeking help is just extraordinarily powerful. I will say, just as on a secondary note, that we also received a second USDA grant in 2020 and then in 2021. It's not on this timeline, but another grant from SAMHSA to continue this work. So we've had 2 cycles of consecutive USDA and SAMHSA funds to work on these issues at large. It was 2021 that we began, or that we continued our recruiting additional farmers. We added 3 farmers to our mix and really allowed us to close out the film. We have an initial, you'll see some of these brief intros to these farmers here in a minute, but we start with a film about the general challenges of farming and the connection to mental health and stress and our physical health. We moved to a farmer who had a significant car accident. Farmer was transporting cattle and just had a head-on collision, and relied on his family to help pull the farm through during that time. The third one is Nathan, who I've already described, and the fourth farmer is Will Gilmer. And Will is just next door to us over in Alabama. He's Mississippi State alum. Will is a dairy farmer. I believe he says in the film a 7th generation farmer on that land. Will talks about the challenges of dairy farming in general, and he says something to the effect that I think is so powerful. Back to that notion of the agrarian imperative, about the connection to the land. He says that we've realized it's more important to our family to be farmers than it is to be dairy farmers. And so they have begun, as they've seen the writing on the wall, the dairy industry was in turmoil, and that the days of small dairy might not be sustainable, or are coming to an end. Small dairy is not sustainable. They've begun transitioning, and I think that's such a powerful piece of the story to tell as well, that there is hope beyond your current approach to farming. You can still be a farmer, and you can still work the farm, work the land, but maybe in a different way than you've historically thought. And so as we completed the films, began the editorial process, we began to work with our partners to plan dissemination. I want to say a word about words. We initially started down the road through farm stress and thinking about the isolation that happens on the farm. And we initially worked with the working title was isolated on the farm. But as we brought this to a close and we had early versions that we were asking stakeholders to review, one of the consistent bits of feedback that we got was that the title was too dark. The film is already dark, just to be real frank. It's a hard film to watch. That's consistently a message we've gotten as well. Wow, it's moving. It's important. It tells the story well, high quality, all those kinds of things. And it's hard to watch. It's not something to watch on a Friday night when you just want to kick back with a bag of popcorn and relax after a difficult week. It really is designed to force you to think and to reckon with and wrestle with the data around farm stress and the stories of these individual farmers. So we, in response to that, we dropped isolated and we just call this On the Farm, because words do matter, and we do want folks to be willing. I mean, who wants to watch something called? I mean, that certainly does sound dark, and so we took that advice to heart. But I just wanted to kind of as I'm unveiling, pulling the curtain back on some of this sausage making process, if you will, thought that was something interesting and maybe notable to share with you. So I want to spend a minute now and just show you a couple of the trailers from the film. I'm not going to show you any of the full films. What I didn't say that I probably should at this point is that the films are about 12 to 13 minutes each. Each story of the 4 stories. They are designed to be standalone pieces so that you can pull one out. I'll talk about the importance of why that in just a minute. What the trailers don't show that I also think is very valuable and we are very proud of here at the university, and it's back to that notion of contextualizing the data and the literature and the research that's out there, is we tell the stories of the farmer, and we also have expert testimony, if you will, of our faculty here. So we have 2 agricultural economists who unpack the economics. There's just one scholar in each film. So in Edward's film, the first film, and in Will's film, the last film, we have agricultural economists. In Steve Sanford's film, who's the gentleman that you see on the screen right now, we have a family scientist who speaks. And then in the third film, Nathan Casburn, we have a clinical psychologist who speaks. 3 of the 4 of those are from the College of Ag and Life Sciences. We we certainly don't limit our work to our division here and our college here at the university. And so our clinical psychologist colleague is over in the College of Arts and Sciences. And I just bring that up for those of you who are working in academic environments. And as you think about the network that you leverage for potential work like this, be sure not to just look in your own silo, but consider who outside in other departments and other aspects of campus are helpful for that. So let me just pause for a minute. I'm going to show you a couple of trailers. One that was developed for TV is a 30-second trailer, and the other is about a 55-second trailer. These will give you a sense of the flavor of the films. I'm going to stop this share, and I'm going to reshare from Philip and Valentina, if I'm not sharing sound when I click play here, I ask that you please just let me know that.
Sure thing.
In a minute, I heard tires squealing. He hit us. I mean, just pretty much a head-on accident.
I was so stressed out, I went to the doctor and I thought I had a heart attack. It was just farm stress.
Like suicide rate on dairies is very high. It's bad, and a ton of that comes from the feeling of I've let my family down.
I kind of felt like I didn't belong and I didn't want to be here.
You'll hear some of the same statements in this next one, but it's a little bit longer. So if you haven't watched the films, I hope that you are maybe will now consider taking a look at them. I've got a few more things to share with you. So in 2022, this year, what have we been up to? The films are finished, as you could see on that last trailer. They aired. That was an advertisement a trailer that we used to advertise for watching the films on our public broadcasting station. So there's a whole lot that we've done. We've built a website. Would encourage you to view onthefarm.life, www.onthefarm.life, where we are putting an extensive amount of resources around the film. We've gotten advanced praise including from some of y'all's folks for the film, and have been very intentional about pushing this out, getting buy-in before it went live, giving folks a sense of ownership and really buy-in to the process and buy into the work. Before it actually went on MPB. So we had some folks, some chatter in the communities. We've really fostered that intentionally. This website is certainly a work in progress. We building out a cast and crew page where the names of those that worked on the film and those that are in the film they're listed, and then as time goes, we'll certainly add some information about them. Our collaborators page is something that's important to us. We want to share those that have collaborated, and I'll speak about that in just a minute. This is something I want to spend just a minute also talking about. Is our goal with this is not that we completed it, we aired it on our public broadcasting station, submitted it for some awards, and put it on a shelf and patted ourselves on the back. No, actually, we're really in our view, from our perspective, the work has just begun. We believe that it's imperative we use this to aid our work in moving viewers from awareness to understanding behavioral intention and even action. Those are words for those of you that work in extension or health behavior, even marketing, probably know that we don't want to just make people aware that there's an issue or a need, but we want to help folks move to taking action. And so we have developed a discussion guide that will be available on the website in the next couple weeks. I really thought I would try to do this myself, frankly, and I as I was looking for resources on how to develop a discussion guide, because this is not something I've done before. This is all new for me. I came across a website, a blog actually, for a woman named Dr. Faith Rojo from Ithaca, New York, who is a PhD prepared former faculty member who has expertise in media studies. She writes discussion guides, y'all, for PBS documentaries. She is a published author on media related issues and how people learn from media and from film. I reached out to her and asked about the possibility of commissioning her to do this work. And I won't get into the details of fees and expenses, but it was extraordinarily reasonable. And she was very easy to work with. She took our films, and I can't say enough about the importance of working with experts, from David Garraway and his team in developing film to now this discussion guide writer to help us build a tool that our extension agents, Farm Bureau professionals, and others can take and use to show a film, show one of the stories of Edward or Stephen or Will or Nathan, and move that audience, move those participants from just awareness or some sort of resonance with the material to actually understanding what's going on. And y'all, it's not just our ag populations that we're trying to move the needle with. I think we're trying to move the needle, but also, and really maybe more importantly, our healthcare professionals in Mississippi, be it clinical medical sorts of care or mental health care professionals, they have very little understanding. Mississippi's 52% rural. 52% of our people live in rural areas. Agriculture is the #1 industry in Mississippi, and yet those that work in healthcare and in mental health care don't have a sense at all of the challenges that our ag producers face. And so we are very proactively using this film to tell that story to our healthcare providers, so that when they're treating and taking care of our farmers and their families, they can know and have a baseline understanding of what's going on. Could we put new research presentations at their conferences and maybe get some of them in the room? Absolutely, we could, and we are. We've got data, and we're going to the Mississippi Academy of Family Physicians, the Mississippi Psychological Association, and the Mississippi Counselors Association. We're doing all of that, and we're also now bringing the film, and we're using it to help us have this conversation so that we move the needle on the work. I mentioned that we've had some success, and it's been a lot of fun, and indeed we have. We were recently, a couple weekends ago, at the Southeast Regional Emmy Awards in Atlanta. We brought home 2 Emmys specifically for the story and the science, if you will, the storytelling and the interaction with the science on the film. And then there were 2 additional Emmys that came home for the technical work on the film. The guy in the middle, James Parker, is our secret sauce. James is the guy who did all the filming, did all the interviews for the stories, got them to really tell their stories in a real authentic sort of way. James has a way of just, he goes very simple. The production, you wouldn't believe when you watch the films, you won't believe this, but it's just extraordinarily simple. James and a camera. And the camera's in the background, and James just really locks in and has a conversation with these farmers, gets them to unpack what's going on and what their experience has been. James won an individual award, and David won an individual award as well for the technical work on the film. It is absolutely essential that I mention some of the partners that we're working with, and these are logos from different folks that have been either integral so far or with whom we're working for events in the future. You can see Farm Bureau, they've been a great supporter of us in this work. Our State Department of Agriculture and Commerce and our Agricultural Commissioner has been fantastic. In fact, he has a short spot at the end of the film endorsing essentially the messages that folks just saw and encouraging people to get help. And our commissioner is a very tough kind of guy. Got a very he also happens to be a Baptist preacher, and so that speaks to a certain segment of the population. He's a well-regarded attorney, so kind of a man of many hats, and so he reaches a lot of different people. And it's very valuable to have his word of endorsement for this. I mentioned MPB and our public broadcasting station. They premiered this for us initially. I'm slated into the end of July to give a grand rounds at our school population health at our academic medical center. I'm working their logo up here yet, but I'm working with our School of Medicine at University of Mississippi Medical Center. William Carey University's College of Medicine's osteopathic school has invited us to do a full viewing of the whole film and have an extended discussion with their students and faculty. William Carey has the osteopathic medical school here in Mississippi has the highest placement of physician graduates in rural areas of any medical school in the country. And so getting their buy-in is not really surprising given their emphasis on rural, but we're grateful for it. I had somebody from Southern Illinois University reach out to me wanting to use the film. And again, the Mississippi Psychological Association is another example of places with providers in Mississippi where we're taking this and using it to advance the conversation. And y'all know we wouldn't be extension and this wouldn't be public health if we weren't doing some sort of evaluation. And so we do in fact have an evaluation piece for this. It should be on Qualtrics shortly, and we'll be using that for folks to use. We'll have that for folks to use when we do show the film and have these sorts of discussion sessions because we want to be able to show the impact of the film on people's attitudes and behaviors and behavioral intention. So with that, I'm going to wrap up. I'm excited to take questions and want to hear from you all about what's intriguing, what did I miss, how can I fill in, what gaps can I fill in? And let me just say also, the film is public domain. We would love for you to reach out and let us know if you are going to use it. We're happy to share a preliminary version of the discussion guide if you've got an opportunity to use this very soon. The discussion guide will be available on the site later for download on demand. But I'm eager to hear what questions or ideas or thoughts you have.
Well, thank you so much, Dr. Buys, for your presentation and sharing about kind of the whole process and the storytelling of it. So wonderful presentation. Yeah, as Dr. Buys said, at this time, we'll go ahead and take questions. I do want to say really briefly that that website onthefarm.life that Dr. Buys mentioned, I'll include that in our follow-up email that goes out to all registrants. So if you missed it or if you want to share it, everyone who registered will receive that in a follow-up email. And David, if there's any other links you'd like me to include, we can touch base on that afterwards as well. So yeah, feel free to use the Q&A or the chat to put any questions or comments. We do have a couple comments in here as well. I'll go ahead and read that one. And if others want to type things in, feel free to go ahead and do that. This is from Carmen. I understand the unintended consequences of farming include chronic pain, needing continuous medical treatment, often leading to opioid misuse. My student and I did a research to assess farmers' perspective of I'm thinking maybe that's medical marijuana as a treatment alternative. The work is ongoing, but the majority of the survey participants would use medical marijuana to treat a covered illness. Didn't know if you wanted to add anything to that.
I think that's fantastic. We've not delved into that at all, but certainly consistent with what we're seeing, changes in attitudes around medical marijuana, more understanding of its value. So I'm excited to see that. What, Carmen, if you don't mind telling me what state you're in, I'd love to follow your work.
Great. Yeah, and as others are typing in questions or comments, I just wanted to ask David. I had a question throughout. So, one of the things that we've come across in the southeastern coastal SSC AHS is, the idea of stigma of getting help for mental health within agriculture. Is that something you have found in the making of the film and talking with farmers? But then also, kind of this part two of this question, do you think that the tight-knit community that a lot of rural communities and agricultural communities have, once we kind of, once the ice is kind of, the seal is broken, where we can talk about these things, do you think that that in and of itself could be a strength to allow greater conversation and greater kind of salience of the topic of mental health treatment and help. I don't know if you have any comments on that.
So I would say yeah, I mean, if you can break that seal, I think it could be very powerful. The challenge is the pride and privacy, and I say pride. I mean, pride has a negative connotation in some settings. I don't mean that in a negative sort of way. I mean, there's this sense of, man, look what we've done in a healthy sort of way. There's a lot to be proud of for farmers and for producers. The fact that they weather those storms literally and proverbially year after year after year, and have maintained their family land for, in some cases, 7, 8, 9 generations. I think a lot of pride there, but I think that there is a negative side of that, a prohibitive side of that pride that keeps that seal pretty tight, and they just won't talk about it. I mean, they'll go to the coffee shop. What we're seeing anecdotally, they'll go to the coffee shop and talk about the weather, how difficult it is, and they'll gripe about whoever's in office, and prices and fuel and seed. I mean, all that kind of, they'll talk about, all around those sorts of things, but they won't talk about how it's getting inside their head. And so that's what we're trying to, not that we want the coffee shops to become group therapy, but we do want there to be a little bit more willingness for folks to seek help from professionals. And that's what we're working towards. So I think that I'm really answering your question as well as I'd like to. Yes, if we can break that seal, that would be powerful. I don't know how realistic opening up the conversation on a routine basis in communities is. Now, we did see in that Farm Bureau survey that I referenced from December of 2021, we did see the needle move a little bit across the country. I mean, on average, with the folks that responded to the survey, in terms of a willingness we saw a little bit of reduction in stigma.
Got it. Thank you. No, I think that answered the question, and it was less of a question and more of a discussion piece as well. So no, thank you for addressing that. Yes, so there was another comment in here from Angie. I think this is awesome and similar to what I would like to see here in North Dakota regarding farm and ranch incidents, accidents, injuries, in terms of storytelling and getting communities to talk together. I see this as almost an opportunity to create public awareness, commercials on our local TV stations on this topic. As when you showed us the trailer, that's instantly what I thought of was how we make this a TV commercial too. Excellent work.
Thanks, Angie. And I would say, in our case, we had the funding and were able to pivot what we had originally proposed. I don't know how open our federal agencies will be to funding development of film like this in the future, if that's the outright proposal that's made. What I would say is think about who partners are and who's got the money for that work. In our case, our TV center, as I said, did it. We paid for it out. We paid full production price for it. But there are mechanisms internally at the university for covering some of public issues kinds of film development like that. So think about who you have got at the university that could maybe fill in some of those gaps if you want to do that. Think about your Farm Bureau, your State Department of Ag could also be potential funders for something like that. Don't forget the State Department of Mental Health. They are maybe called something different where you are, but if you can, maybe start to think about some coalition building of folks who could fund the development of some stories on film like this. And then your for-profit, television, your public broadcasting, which should be a part of that, but also don't leave out your television stations that may have some interest in a give back around something like this. Or there may be folks that work for TV that are willing to work with y'all on the side to do something of this nature. So I think the possibilities are endless for pulling together the resources to make something that fits your context.
Great. And I see Carmen did share her email address. So David, you can take that down. And then Valentina also mentioned, and I think you mentioned that the discussion guide is not available yet, but when it will be available?
Probably 2 more weeks. We've got it with graphic design right now. We initially were going to publish it just as a discussion guide, and we've more of the sausage making process here, but we've decided to really put one document together with a kind of a promotion toolkit and a little bit more background on the film, and so beyond just the questions for the discussion guide, kind of make a more comprehensive document. So that's what our delay has been. But the questions are ready, and I'm happy if somebody has an opportunity to show this right away. I'm happy to share it, and just by email in a Word document.
Sure. Yeah. And will it be on the farm.life website when it's ready?
Yes,
okay.
It is. We are or just kind of casual discussion here, but we are trying to decide if we're going to put it, require sort of a registration to download it. We'd like to track. I mean, we want to make things as public access as possible, and we're not wanting people to have to get permission or proactively write us to get it. But we're maybe thinking about a web form that's required for access to download that. Working on the back end stuff on the web for that as well.
Yeah, that sounds great. Yeah. Were there any other questions or comments that we'll give everyone just a couple more moments here if you want to type those in into the chat or the Q&A. I'll go ahead and pull up just our closing slides, but feel free to type those in. We still have a few minutes left today. So as we're closing, I do want to just briefly promote next month's webinar for the Southeastern Coastal Center. It'll be on July 14th at 11 a.m. And we're joined by Dr. Ashley McLeod-Morin, Associate Director of Strategic Communications for our center, for the Southeastern Coastal Center. And the title is Emerging Topics and New Collaborations in the Southeastern Coastal Center for Agricultural Health and Safety. So this past year, we've been going through a renewal process, grant renewal process for the center. And so Dr. McLeod-Morin will be sharing a little bit about that and some of the collaborations we have coming up. So you'll be able to register by going to sccahs.org. We'll be getting that one kind of more prominent on the homepage after today. And I'll also include a link in the follow-up email as well. Also, I do want to promote very quickly with the UF-IFAS PI Center, which I mentioned where my association is with, as well as Valentina. We have a podcast. It's called Science by the Slice. And today, kind of coincidentally, we released 2 episodes this morning. And the title of the overall title is Understanding Substance Misuse in Agriculture. Like I said, it was more serendipitous. We didn't plan it this way with having Dr. Buys speak in our webinar series, but Dr. Christine Chasik and Dr. Heidi Radunovich. Dr. Chasik is from the University of Nebraska, Omaha, and Dr. Radunovich is at the University of Florida. And so they talk about that. And so you can just search for Science by the Slice wherever you find your podcasts. Also, you can go to picenter.com/media/podcast. And I'll put that in the chat as well as we're exiting. And besides that, just want to say thank you. Once again, as you're exiting today, you'll be able to do a follow-up survey. It should automatically load in your internet browser. It takes about 3 to 5 minutes tops. And we appreciate your time there. And then I see Dr. Buys put his email up and his Twitter handle and his LinkedIn. So if you want to reach out to him as well. Dr. Buys, do you want to say anything else before we close today?
just thank y'all. Thanks for being here. Thanks for the opportunity to tell the story about the stories. And please let me know if y'all do anything like this in your states. I'd love to follow back. And we're certainly learning. We do have funding for another round of this work, and we're currently trying to decide what direction we're going to go. And by the way, I would welcome feedback on that, especially if you watch the films. I mean, we can follow the same formula, and we're talking about that. Do we just do 4 more stories about farmers and different commodities, or do we pivot and do something around farm families explicitly, or instead of 4 12-minute stories, do we do 2 stories that are longer, do a deeper dive? So we've the sky's the limit in terms of where we go. And if you've got thoughts about that, we are all ears as we try to make this happen.